Well, typically speaking, we always want a band of thick protective gum tissue to surround every tooth. It basically acts as a physical barrier to keep plaque and bacteria out from underneath the gum line. But the problem here is sometimes genetics plays a role, or sometimes hard toothbrushing plays a role, where patients typically don't have a lot of that protective gum tissue to protect their tooth. So eventually the gums start to recede back as a result. And before the gums recede, the bone is lost. And so if you leave it untreated, what typically happens is the tooth will eventually loosen up and it'll be lost. And because of that, if you don't have a lot of gum tissue or bone, then replacing it with, say, a dental implant may be very difficult as well. Leaving progressive gum recession untreated can definitely have a lot of downsides on you, in the sense that a tooth can eventually loosen up as a result. That gum recession can spread over to the next teeth over, so then what was going to be a one-tooth problem can now turn into 3 teeth automatically. The treatment of gum recession is typically done with soft tissue grafting. If you touch your tongue to the roof of the mouth, you'll notice it's nice and firm. That's the sort of tissue you want to surround every tooth. And so typically what I would do is I would take a small piece of tissue from the roof and then just replant it where it's needed. However, sometimes the patient's gums are a little too thin in those areas, so there's always alternatives. We can certainly use materials in order to accomplish the same thing. The main goal of soft tissue grafting is basically to prevent this from getting worse. We're trying to basically build up some tissue to protect it and wall it off from further progression. And in some cases, we try to cover some of the roots that have been receded back as well.